It's time for answers to your medical questions and get an inside look at the latest in healthcare, technology, and treatments. This is Rex on Call. Welcome to Rex on Call, live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today, we are talking about beating breast cancer. If you're watching us live and you have questions, they could be answered by our experts. The physicians taking your questions today are Dr. Barbara Dull with Rex Breast Care Specialists and Dr. Courtney Bowie with Rex UNC Radiation Oncology. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com, and find us on Twitter and send us a message at RexHealthcare #RexOnCall. For years, doctors have encouraged women to do monthly breast self-exams to check for any changes because the earlier the diagnosis, the better the outcome. We spoke with one woman who knew something was wrong, but oddly enough, the mammogram came back normal. Here's the story of a woman's persistence that turned out to be a lifesaver.
Hi, how are you? Oh my goodness. Oh, thank you.
Follow-up appointments to UNC Rex Cancer Care are surprisingly a joyous occasion for Anna Freeman.
They show the most care and passion for what they do in any place I've ever been to.
Anna has an upbeat approach to what ordinarily is a frightening life experience, breast cancer. Anna says before her diagnosis in February of 2014, she knew something was wrong.
It feels like I could just take my hand and pull whatever it is out.
After 2 normal mammograms, the ultrasound showed what Anna had already felt.
To me, it looked like it was the entire breast. It looked like a fist. My breast cancer was in my milk tub, and I didn't want to take the risk of it returning.
Successfully completing chemotherapy, a double mastectomy, and radiation, Anna credits her faith and the UNC Rex team for surviving breast cancer.
Breast cancer is for the most part curable, not just treatable, but curable.
Anna's breast surgeon, Dr. Rachel Gendro, says many times the first diagnosis is in your own hands.
You know, breast tissue is very lumpy bumpy, and that's normal for everybody. So I have a lot of women say, I don't know what I'm feeling for, what I'm looking for, but you get used to your own tissue. So I really advise that they do a self-exam once a month, and you'll get used to what your normal tissue feels like. So if there's something new or different, then you'll be able to tell that difference.
Being in tune with her body paid off for Anna, who says she has a lot to be thankful for.
Leanne, I will never forget her as long as I ever live.
One of 4 breast cancer navigators with UNC Rex Cancer Care, Leanne LeClaire, helps patients through the treatment process.
We want to speak with them. We want to see what kind of barriers to care they may have. Do they have emotional support needs? Do they have spiritual needs? Do they have questions about their diagnosis, which everyone does, of course. So education is a key point of what we do.
An advocate for patients, but your first advocate, says Anna, has to be yourself.
But it's very, very critical that we stay in tune to our bodies and know when there are changes and know when things isn't right and be persistent.
Dr. Gendro says she's seeing more and more younger women being diagnosed with breast cancer and choosing double mastectomies. So what are those deciding factors when making that choice? Let's bring in Dr. Barbara Dull and Dr. Courtney Bowie. Thanks so much for being here, ladies.
Thank you.
So how do you make that decision to move to the double mastectomy, especially for younger women?
Right. So usually when we are seeing women who are just diagnosed with breast cancer, for many women they do have the option of lumpectomy versus mastectomy. And we go over what those surgeries entail. And if a woman opts to undergo a mastectomy, that comes with either no reconstruction or meeting a plastic surgeon and doing reconstruction. Now we always explain to women that there is no survival benefit to doing a double mastectomy for most women unless they have a genetic mutation. They're going to live to be 80, 90 regardless of whether they have the breast with cancer removed or the other breast, because the likelihood of having cancer in that other breast in their lifetime is actually quite low with all of the other treatments we're going to recommend. But it really does come down to, do you want to continue doing mammography of that other breast throughout your lifetime? So it's an anxiety thing if anything ever gets found, which it could be benign or malignant. And then it comes down to a symmetry thing as well. The breast that you do a mastectomy on is never going to look like the other one.
The other one, all right. Dr. Bowie, as a radiation oncologist, at what stage do you begin caring for a patient?
Right, so we generally will see patients once they're diagnosed. And there's a couple of times we might see a patient. Sometimes women, once they get the diagnosis, want to see all of the providers that may be involved with their care. And then we will meet them at that point and let them know, whether or not they may be candidates for radiation. We can also help patients decide on surgeries. For example, some women who have very early stage breast cancers, like Dr. Dahl said, do have the option of mastectomy, and those patients may not need radiation afterwards. However, if they have a lumpectomy, oftentimes those women will need radiation. And so we like to let patients know what is available to them at the outset. Some women come to us after surgery, and at that point we review pathology with them, and we let them know whether or not they need radiation and what type and for how long.
Basically, it's so personal for each and every patient. There's no one protocol that fits many. It's very individualized. Right? Okay. Well, Rex Care Specialist is part of Rex's comprehensive breast care program. Dr. Dahl, can you talk about this collaborative approach that you all take in caring for your patients?
So as Dr. Bowie was saying, it's, you have multiple physicians. So usually where the surgeons are the first people that the patient will meet after they have met the radiologist. And we at Rex do our own ultrasound guided biopsies in the office. And so when we meet the patient, we sit down and we talk about pretty much treatment of surgery through possible radiation and any systemic therapies, but they will eventually meet a radiation oncologist like Dr. Bowie, as well as one of the medical oncologists. The thing that's unique about the Rex surgical program is we have nurse navigators that the patient meets at the time of diagnosis who help them through the whole process and are available to them really 24/7.
That's the consistent face they're always seeing, right?
Exactly. Okay. And we do have a multidisciplinary tumor board that meets every Tuesday morning where the pathologist, radiologist, radiation oncologist, all of these physicians are there and talk about each case to get a treatment plan together.
That's very comforting, knowing you got lots and lots of people on your team. Dr. Bowie, let's talk about older patients. Is there a change in the way you treat women with radiation, for example, over the age of 70?
So there have been a number of studies that have come out, I would say, over the last 5 to 10 years that would seem to indicate that perhaps as women get older, their tumors may not recur with as much frequency as a younger woman, and perhaps their life expectancy is not such that they would live to experience a recurrence. Perhaps they have other serious illnesses that need addressing prior to their breast cancer. So we talk to those women, and we have a conversation with them about their what we perceive their risk of tumor recurrence is, because radiation in this setting is given to try to prevent recurrence after surgery. And we talk to the patient, trying to come to a decision with the patient as to whether the risk-benefit ratio works out without radiation or with radiation.
Okay. Can you talk about, Dr. Dahl, the latest advances you have surgically at Rex and some of the newer things that you might be performing?
So one of the newer advances in breast cancer management from a surgical standpoint has been the increase in nipple-sparing mastectomies that we're doing. So with the routine skin-sparing mastectomy, we have to remove the nipple and areola complex, and then a plastic surgeon can potentially, down the road, reconstruct it and do tattooing. But with this nipple-sparing approach, we use either an incision under the breast or out laterally, and so it's pretty much what some say is hidden surgery, because we remove all of the breast tissue through this lower incision, and then you really can't tell that a woman's had
so
a mastectomy.
Aesthetically, it's
right.
It's a much nicer outcome per se.
It's a significant advancement, but women have to fit a certain criteria in terms of breast size and where their cancer is. A lot of women choose that option if they have one of the genetic mutations that puts them at an increased risk of developing breast cancer in their lifetime, and choose that approach to decrease their overall risk.
Okay. All right, well, lots more to talk about. And as we go to break, we want to tell you about the Rex Gala on October 24th at the Raleigh Convention Center. Proceeds from this year's gala will benefit the Rex Patient Assistance Fund, which provides financial support to cover transportation, medication, and other expenses related to treatment. We are back right after the break to answer your questions. Give us a call or send us an email.
It's never just one thing that makes a place unique. Around the triangle, you'll find a blend of the visionary right alongside the tried and true. At UNC Healthcare, we're building a system that brings together expertise and empathy. Those two things mean complete care for people all over the triangle and around the state.
You still remember when you got the diagnosis. It was as if your whole world came to a stop. All the things you cherish. What didn't stop was the comfort and support you received from UNC Rex Cancer Care. Community-based care, combined with world-class, innovative treatment tailored to your needs. It turns out your diagnosis wasn't the end of hope. It was really the beginning.
North Carolina Heart and Vascular is hard at work providing exceptional cardiovascular care to you and your community. And because we're your neighbors, what matters most to us is getting you back to what matters most to you. Visit us at ncheartandvascular.com.
Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on beating breast cancer. If you have questions for our experts, call in now, 919-744-3876, or you can email us your questions. Go to WRAL.com and search Rex on Call. Let's get to some of those questions. We have a caller from Raleigh. If you have a family history of other cancers, are you at a higher risk for breast cancer? I think this is probably a pretty common question.
Right. So a lot of it depends on what cancers and who in the family has had the cancers. So if you have any question at all, just be referred to a breast specialist or a geneticist to discuss those risks, because you may not be at an increased risk of breast cancer, but there could be something else that's
Other
found.
sort of things.
Right. Certainly, we want to see any woman whose mother has had breast cancer or whose sister has had breast cancer, because those are considered the first-degree relatives, and we can evaluate that woman and see if she's at a higher risk and if there's anything that we can actually do to minimize the risk.
Here's a good question from another caller from Raleigh. When is the best time of the month to do a self-breast exam?
Do you want to take this one? Do you talk to patients
Okay.
about this all the time, I'm sure.
So I think there's no best time. Just be consistent from month to month.
So if you say you're going to do it on the first of every month, do
Right,
it on the first
especially in premenopausal women whose breasts change during their menstrual cycle, just making sure that you're doing it at the same time every month so that you know what your breast should feel like.
Okay. This caller from Henderson, she has cysts in her breasts and she gets her annual mammogram. Are cysts a normal thing in breast tissue?
Yes, they are, and particularly in women around their menstrual cycle, or say if a lot of women experience this if they drink caffeine or eat chocolate. Sometimes the cyst can pop up.
Why do you have to get punished with
That's
that,
right,
right?
that's right.
Coffee and chocolate.
That's right. And so those are not cancer. Now, they can feel like cancer. So we always tell women that if you're doing your self-breast exams, you're going to figure out what your own breasts feel like. And so if there's something different or a change, and it's not time, say, for your regular mammogram, or say you're not old enough to have a mammogram yet, you want to bring that to the attention of your provider so they can get it checked out.
Okay, let's talk about those screening guidelines. Starting at age 40,
Correct.
unless there's some sort of close first-degree family history, would you say?
Yes, exactly. So all women should start having their bilateral screening mammography at the age of 40, unless there's one of those first-degree relatives. Then it's 10 years before their diagnosis. So if your mom was diagnosed at 45, you should start screening at 35. And then if you're found to have one of the gene mutations, it's actually even earlier than that. We recommend starting at 25.
Wow, okay. How often, this is a question that came from Twitter, how often does breast cancer spread to other parts of the body? And how common is that?
That's a somewhat difficult question to answer. Breast cancer, if it's an advanced breast cancer, typically will go to, say, the bones or the brain or the liver, and a lot of our patients are very afraid of that. Fortunately, these days, a lot of times we're catching the cancers early, so the likelihood of spread is extremely low. And even for more locally advanced cancers with aggressive treatment, the likelihood is also quite low.
Okay. We have a patient here, a caller, Mrs. Moore. She has dense breasts, gets her annual mammograms. Should she ask for an ultrasound, or would that just be indicated by her physician?
So the ultrasound would be indicated by if she felt something abnormal on her exam, if her physician did, or if some abnormality was found on mammogram.
Okay, so there has to be a reason.
If her mammograms have not been changing, then there's no reason for an ultrasound.
Okay, all right. Breast cancer survivor here. She had chemo, radiation, double mastectomy. She's doing very well now. We're so glad. This is Miss Carlisle from Rocky Mount. But she'd like to know, when can she say she's in remission? Is this a tricky area?
Right.
I'll take this one. So, and I talk to people about this all the time, because I think the usual way we progress through breast cancer treatment is to say maybe have surgery, possibly some chemotherapy, and radiation is usually the last stop. So at the end of radiation, people always ask me, am I cured? You know, do I have cancer? Am I cancer-free? And I always tell people, you know, I don't have a crystal ball. I never tell anybody 0 or 100% for anything. However, we can give people the percentages and the likelihood that they may be cured, so to speak. And I always tell people that we watch everyone very closely the first couple of years after treatment, up to 5 years, and then we still follow people for decades after their breast cancer treatment. But at that point, we're hoping it's more of a social visit. Okay.
Yes. All right. Well, coming up, we will answer more of your questions. Give us a call at 744-3876, or email your questions at rexoncall@rexhealth.com. And as we go to break, how would you like to win the ultimate Carolina Hurricanes game experience, including 4 lower-level tickets, a pre-game dinner at the Arena Club, and a meet and greet with 4 of the players after the game? Rex is teaming up with the Hurricanes this October to bring awareness to breast cancer. All you have to do is follow Rex Healthcare's Facebook page and comment on the pink post every home and away game this October. You also have the chance to win a signed hockey stick from the Hurricanes by following Rex Healthcare on Twitter and tweet #RexSaves during home games this October.
I couldn't count the number of times over the last 25 years, the yo-yo diets, the programs that didn't work. I wanted to get off that weight loss roller coaster. To date, I have lost 124.5 pounds. Rex gave me my life back.
Every delivery tells a story. At Rex Women's Center, we believe that story should be a cherished experience. It should be about personal comfort, compassionate caring, confidence building, continual guidance. Rex Women's Center provides a personalized, comfortable experience before, during, and after the birth of your baby. Rex Women's Center, chosen for excellence.
Hi neighbor, we're the dedicated team at the new UNC Healthcare Hillsborough campus, here to bring the exceptional medical care you'd expect from UNC closer to home. The new UNC Healthcare Hillsborough campus. Exceptional healthcare, incredibly close.
When you're 502 pounds or 500 pounds, I never really once thought, hey, I'm sick. My thought was, I'm fat. It took me a while to realize really what Rex was. And it is a wellness center. It's about getting better. It's about healing.
Welcome back to Rex on Call here live on WRAL. And to reach us at Rex on Call today, you can give us a ring at 919-744-3876 or email us at rexoncall@rexhealthcare.com. You know, the earlier you're diagnosed, the better chance you have for recovery and survival of breast cancer. But we all know women, and mothers in particular, tend to put their needs on the back burner after work and taking care of their families. That's why the Rex Mobile Mammography Unit is so critical.
Well, I have an aunt. She had breast cancer on my father's side, and my younger sister, she's a 3-time survivor.
With a family history of breast cancer, the Rex Mobile Mammography Unit helps Elaine Bonner monitor her own breast health every year when it parks at the North Carolina Department of Revenue in downtown Raleigh. The convenience, she says, is priceless.
Not having to leave work for an appointment with the traffic and travel and just step outside of the door. You're here 10 to 15 minutes, you're back at work. Very convenient.
This is one of 2 Rex Mobile Mammography units offering digital mammography screening. The program reached more than 4,800 women in 2014.
Well, we partner with about over 50 corporate business sites a year, and we also partner with medical clinics, health departments in a 15-county radius, other organizations like churches.
The 2 buses travel the region thanks to funding from the Rex Healthcare Foundation, Revlon, KL Cancer Fund, and Susan G. Komen. Some of that financial support also helps provide free screenings for the uninsured.
We do the images here on the mobile unit, and when we get to the hospital, we actually send those images over so the radiologist can view them daily. The results are sent to the doctors that the patients provide us with, and then they're also sent a result letter in the mail.
A convenient, potentially life-saving screening in just 15 minutes.
It doesn't take that long, and it saves your life. It could really save your life.
Just last year, the Rex Mobile Unit was able to diagnose 3 cases of breast cancer. Now, to find out when the Rex Mobile Mammography Unit will be in your area, here's the number to call, 919-784-4210 for more information. And if you're interested in having the Mobile Mammography Unit visit your place of business, just request a Rex Mammography Unit site visit. And this is something you can find on the website for more information about that. We've gotten a couple callers that have told us, we mustn't forget about men because there are men who have breast cancer. This man called in. He suspects that he might have a problem. He has soreness in one breast, and all the women in his family, his direct family, mom and sisters, have had breast cancer. Should he be seen?
He should definitely be evaluated. Usually breast pain or soreness is not related to a breast cancer, but we certainly send men for mammography and ultrasounds all the time to rule anything out. So any, suspicious or concerning symptom, we'd rather, see someone and put their mind at ease.
Sure.
Than
miss
something.
Speaking of breast pain, I didn't realize till we were preparing for this show, it's actually quite common, isn't it?
Yes.
Dr. Bowie, can you talk about that, breast pain in a woman?
Yeah. Well, certainly. A lot of women do have breast pain for various reasons. The typical cases are mastitis or something when you're breastfeeding. The cysts we were talking about earlier, that they can happen monthly, but there are a number of reasons a woman may have pain. And again, as we were preparing for this, we did talk about the fact that oftentimes breast cancer is not painful. And so we do want to stress, though, that if you have any concerns about sensations in the breast or new lumps in the breast, that you get it checked out. Don't be afraid to get it checked out because it may just be a cyst, but we do want to know sooner rather than later if there's something going on.
Okay. If you do detect a lump, is that bad news, or are lumps pretty common as well?
So once again, lumps are extremely, extremely common. They can just be normal breast tissue. They can be cysts. They can be benign things like fibroadenomas. But the only way to know is to get evaluated.
Okay, so don't be afraid to take that next
Correct.
step. Make the call, go get seen.
Exactly.
Okay. This woman calling from Cameron has regular breast exams that are normal, but has that breast pain, but there's a history of breast cancer in her family. Should she have some genetic testing done possibly?
Right. So it all depends on who it is in her family and who was diagnosed. Ideally, we actually, if there's a suspicion of a potential genetic mutation, we actually prefer to test the family member with cancer.
Okay.
Because if they don't have a gene, then there's no reason to test other family members because they can't have a gene.
Okay. We'll have our final round of questions right after this break. This is Rex on Call.
In each child, there's the spirit of a champion waiting to emerge. At UNC Children's, we're committed to helping to achieve those dreams. As a leading children's hospital in the Southeast, we provide care to future champions of all ages. Our world-class care team represents all subspecialties, so no matter your child's condition, you can trust their care to us and leave the future up to them. We're champions of future champions.
In every town in North Carolina, you find a blend of traits that make it unique. It might be grace, alongside grit, or creativity, meeting tradition. At the many places that are part of UNC Healthcare, you'll find expertise and empathy. That kind of care is our mission as a system across the state. Complete care for people all over North Carolina.
Welcome back to the show. This is Rex on Call, and we're taking your final round of questions right now. This woman from Wilson, she had a lump removed from her right breast and followed up with radiation. What are the chances of anything appearing in her other breast? And you touched on that earlier.
Right. So without a genetic abnormality that predisposes a woman to breast cancer, if we treat the side that has the cancer, the other side basically has almost population risk. So it goes back to the basic population risk of cancer developing.
Okay. This woman has very dense breasts. Should she ask for a 3D mammography test rather than a regular one? What's the difference?
Right. So currently the screening mammograms are usually 2D, meaning that you have an image taken in 2 dimensions. The 3D takes several images, so it allows the radiologist to kind of see past that dense breast tissue. So it has decreased callbacks, meaning the number of women who have to come back to have a diagnostic mammogram.
And that's good news.
It's very good news.
Advancement,
yep.
Right?
The thing is, it's still new, and so more studies are being done to prove its efficacy. So not all insurance companies are covering it, so there's usually a small copay.
Okay, all right, but that might be worthwhile just to get that peace of mind possibly and not get a call back.
Correct.
I'm sure that causes all sorts of
a lot of anxiety.
Okay. All right, well, thank you, ladies, so very much. This has been a terrific show. We still have the phones very busy, and we will get to you callers and get your questions answered. And as always, consult with your physician about any health concerns. If you are looking for a doctor beyond today's show, or you need a direct referral, you can call Rex HealthNet. That's Rex's free telephone information service. The number is 919-784-4490. And thank you to our phone bank for taking all the calls. You were busy today. Join us on Monday, November 16th for Rex on Call, and our topic will be diabetes and heart and vascular disease. You can email your questions ahead of time to rexoncall@rexhealth.com. We will see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
Hello, I'm John Heister for the Heister Automotive Group, and I'm excited about the remodel of our Chevy